There's nothing more frustrating as a parent of a newborn baby. You got this beautiful baby boy or girl, and they get diagnosed with torticollis. In this video, we want to talk about the most important thing is what causes torticollis the majority of the time, and most importantly, what can you do about it to help get your kid back running and functioning properly as quickly as possible. Because not only is torticollis obviously when the neck is tilted and stuck and the baby can't move, but it also affects other things with their daily life. It affects their ability to nurse, to feed, to latch properly. It affects their mood, and colicky and fussiness oftentimes comes along with torticollis as well. So we want to start with any problem. Like any problem in life, you want to be able to solve a problem. You must know what causes that problem first to be able to effectively approach how to deal with that scenario. So the most common cause of the birth or of torticollis is the birth process. As you know, as a parent, the birth process is a stressful event. And especially if you add in an assisted birth, like a C-section or a forceps or extraction or delivery, or a vacuum extraction or delivery to the birth, there is a lot of torquing, twisting, pulling, tugging going on during that process. And thank goodness that we have the ability and the medical prowess to be able to get the baby to be delivered safely for both the baby and the mom. But the birth process in any event is a traumatic event. It's in particular to the baby's head and neck. And when you have a newborn baby, it is like baby holding baby 101 that you want to be able to protect the neck when you're holding that baby, because they got a big head and a little neck, and you would never want to do anything to damage their neck. Because so when we hold the baby, we always make sure that their head is guarded and protected. Well, during the birth process, there's no guarding and protecting. There's pulling, tugging, and twisting, as we stated earlier. So that process creates a misalignment or a fixation, misalignment and a fixation rather, to that upper neck area. And that upper neck area is very crucial towards the rotation and the lateral bending of the head and neck. So that birth process can cause a misalignment and a fixation of that upper neck, and torticollis occurs because their head gets stuck and tilted in that position. And torticollis is literally just when the baby's head and neck gets stuck and they can't move it. And it's all due to a misalignment and a fixation of that upper cervical spine. Now, oftentimes the first approach to helping a baby with torticollis is physical therapy. And while that is very effective, physical therapy is working with the musculature. Now, when you have a baby or you have a spine that's misaligned and fixated, that causes that neurology in their upper neck to be overstimulated, to be hypersensitive. And in response to that, the muscles tighten up and they spasm. And the muscles aren't tightening up and spasming because it's a muscle problem. The muscles are just doing that tightening and spasming to try and protect the baby's head and neck from further damage. So, chiropractically speaking, our job is to get that upper cervical area moving better. We need to get rid of that misalignment and get rid of that fixation that occurs in the upper cervical spine. And when you do that, which oftentimes takes time and repetition, then those muscles are going to relax. The muscles are going to follow suit. And chiropractic care works phenomenally, and it will dramatically expedite the process along with physical therapy in getting the baby's torticollis to improve and getting that range of motion and that fixation and that rotation and lateral bend and whatever they're stuck in, whatever presentation they're stuck in, to dramatically improve so much quicker when combined with both of those. So if you're watching this video and you have a child that is struggling, or you know a child that's struggling with torticollis, please bring them in to get checked by a neurologically focused pediatric chiropractor like our office. Or if you can't find anybody, please reach out to us if you live in a different area, and we can hook you up with somebody that will take great care of your kid and get them back to functioning optimally. Thanks for watching this video, and stay tuned for our next video where we're going to talk about plagiocephaly, or flattening of the head, which oftentimes goes hand in hand with torticollis. So take care, guys. We'll catch you next time.